Good morning, everybody. Welcome to Ask Damsey, and I am Bumi Adeniro. With me in the studio today is Adedamola Aladejobi, who
Ladejo.
Ladejobi, who everybody knows in Nigeria as Ask Damsey. But the superstar of today is Dr. Lo Carson. Dr. Carson Lowe started his education in the Philippines. Just to do a little bit of introduction. And I'm so amazed, Dr. Lowe. I did not know that you're from Philippines, but that's a question for another day. So at the University of East Ramon Magsaysay Memorial College of the Philippines. But he didn't become an infectious disease doctor until you moved to United States, right?
That's correct. So,
Go ahead, tell us.
no, yes, I basically migrated from the Philippines to the United States, and I started my internal medicine residency in Chicago at University of Illinois in Chicago. Then I did my infectious disease fellowship at UCLA, University of California, Los Angeles. So at that time, actually, it was the peak of the AIDS epidemic. So we pretty much saw the whole spectrum of HIV disease. At that time, we actually had AIDS wards where we take care of these patients. And so I did work for the VA system, Veterans Affairs Systems, for a while. And then prior to coming to Houston and doing more infectious disease.
Dr. Lowe, before we go on, just tell us. I know you're an honest doctor. I've worked with you for almost 4 years now. Just tell us in brief word, what is COVID-19?
Well, COVID 19 is actually a respiratory virus.
Mm.
It is different from the regular coronavirus, which is what we call the common cold. However, this particular virus, the COVID 19, is a new virus that has come into the environment. And it causes serious infection because it can cause lung inflammation and causing bad pneumonia, and to other individuals can cause a leaky lung. So you can basically suffocate to death if you don't get into a respirator because of the severe consequences of inflammation in the lung that is caused by the virus.
Okay, that's a very good introduction. Ask Damsey. I can mute
Yeah,
you if you need to do something. I can mute you. So,
it's
but are you
fine.
fine? Okay.
I'm fine. I'm fine.
Okay.
And I heard the
Okay.
introduction. Thank you, Dr. Lu.
Okay. So I'm gonna turn it over to you, Sister Adedamola. Go ahead.
Adedamola. You can just call me Dams to make it easier if my name is
Dams.
too long.
That's good.
Dams, yes. Everybody
Yes.
calls me Dams. Okay. Thank you so much for your time, Mrs. Adeniro, and thank you so much for your time, Dr. Lowe. I'm so grateful. I'm speaking from Lagos, Nigeria, and it's my absolute pleasure to, to have this conversation with you. Now, where I am currently in Nigeria, in Lagos, Nigeria, to be honest with you, from day one, I feel like a lot of people have not taken the coronavirus as serious as it should be taken. And as we speak, I feel like the numbers are rising. We don't even have enough test kits to start with, as far as I'm
Yeah.
concerned, and from the little research that I've done so far. But before I even start with Nigeria, like what is actually happening abroad? Because the majority of people in Nigeria, they really don't have a clue about what is going on with the coronavirus. But for me, I was already in Europe when coronavirus, when the coronavirus hit Europe, and I saw the numbers, and for me, it was reality hit me at that point in time. But we still have people over here who are saying things like, oh, the COVID-19 is not real. So can you tell us a little bit about your experience with COVID-19, since you are a doctor on the front line of this virus?
Yes.
And how deadly is it?
So, I'm based in Houston, and Houston's really a hot spot right now, and also the state of Texas. We have had a record number of cases, and it continues to rise. This reflects the whole situation of the whole United States, too. So, initially, when it hit Texas and United States, we had a big lockdown from March to May. So that really helped in terms of decreasing the spread of the virus. However, once it was announced that things are more relaxed and they started what we call opening up, then individuals have the misconception that, oh, it's back to quote normal. It's not normal. There's still
Wow.
ongoing spread of the virus that's in the community. So there are asymptomatic patients, basically people who are not sick, and they're carrying the viruses in their mouths. And you start talking without, especially if you don't wear any mask, you start spreading it from one individual to the other. So it's estimated one person can infect up to three persons. Just imagine that, and that's what that spread can be what we call logarithmic. So you can infect several thousand people within a few days in a community. So currently, once the city started opening up and the state, people started gathering together, whether it's in restaurants and bars or even just neighbors getting together. And we saw this especially during the Memorial Day weekend here or the holidays. And people started gathering, and that's when you start spreading the virus. And now we're seeing the consequences of that. So our ICUs are actually pretty much full or almost at the capacity. A lot of the hospitals, half of the hospitals now are all filled with COVID-19 patients. So part of the problem we have now actually is we can't get enough healthcare workers to work. People are getting tired, nurses are getting tired. Uh, and sometimes it's very draining, both not just physically, emotionally, psychologically. It's hard to see patients, suffering and having your patients die from you. And so once you've encountered this, then it's you need some time to recover. And understandably, people don't want to work more hours after you've gone through all these difficult times. So a lot of our problem is really staffing. We don't have enough staff to take care of patients.
So on the average, what is the
You are,
fatality rate?
uh, damn, you are echoing. So turn down your volume or use headphone. Thank you, my sister.
Okay. Okay. Is it better?
Uh,
Yes.
yeah.
And whoever is playing it at the back of anybody, let them turn it down because we're hearing a
Okay.
feedback.
Nobody else is playing it. Nobody
Okay.
else.
Okay.
Yeah. Okay. Should I go on?
Yes.
Okay. My second question, Dr. Lowe, is on the average, what is the fatality rate in terms of like the fatality rate for young people? Because in Nigeria, what a lot of us think, we have this thought that it doesn't really affect young people, and that the death rate for young people is literally non-existent. So is this true or not true?
Well, there are certain risk factors. There are certain individuals, yes, that are more prone to getting severe disease. We know the older patients, so the older you are, the more risk of having bad disease or bad pneumonia and outcomes. Patients who have chronic illnesses, diabetes, patients have hypertension. Um, of course, if you're immunocompromised host, the other risk factor we see a lot are individuals who are really heavy. Obesity is a major factor, and I've
Obesity.
seen yeah, obesity. So people who have we call body mass index 35 or higher, So patients who are 200 over around 300 pounds or heavier, these patients do poorly when they get infected. So I have a number of patients I've taken care of. They come in very sick. They need to be intubated, put on ventilator, and unfortunately some don't make it. And many of them are actually are obese patients. The other
Wow.
things we've seen actually are patients who don't realize that they're diabetics, and when they come in, they actually come in pretty sick, and that's when they get diagnosed. They have diabetes, or patients who have diabetes and their blood sugars are not under control, and they get also do poorly with the disease. It is true that the younger folk, the younger individuals may not be as sick, but that's not necessarily so. So we have seen young individuals, 30s, even 40-year-olds, who actually get very sick and need to be on ventilator. And when somebody needs to be on ventilator, pretty much they're in that state. Usually, will be in a hospital for at least a month or even longer.
Dr. Lo, I wanted to buttress your
Wow.
point
Wow. Wow.
when
Okay, so I'm just
Kenya.
gonna tune in with my earphones now so that to reduce the echoing. Can you end the IGCV and then you can save it to IGCV? Um, so yes, I have a very, very, very thing question. Okay. Yeah. So is the echoing better?
Yes.
Okay. Awesome. Awesome. Good. Just trying to place my phone properly. All right. Okay, so another question that I have is, so in Nigeria, well, generally, let me not say just Nigeria.
Uh,
A lot of people, is there a chance that after having the disease and your body develops antibodies, is there a chance of you being reinfected again, or is it that once you get the disease, you no longer have stand a chance of getting it for life, forever and ever?
well, again, this is a novel virus. In general, once you have a viral infection, like for example, the average immunity we think may last around 6 months. So does it last longer? We actually don't know the answers to that. So that's part of the challenge in knowing how this disease is gonna uh, affect individuals and communities in the long run. Yes, a lot of some patients once they get infected, recovered, sometimes it's very difficult for them to recover. Others have residual respiratory illness, so they're not really fully themselves. Their energy level's not there. Some have persistent cough. So we're still learning about this disease and its long-term consequences.
Wow. Okay.
Uh, Let me ask you a question, Dr. Lo. The last time you talked about 30, 40-year old, I wanted to bring your memory back to a 21-year-old that we had on RAU that had COVID. So it's not going to be 20, it's not going to be 30, 40-year old. A 20-year-old can get it. And I remember one of those cases, maybe it was your partner that saw him. One of those cases was a diabetic and didn't know he was a diabetic.
Yes.
As a 21-year-old, you still have a lot of energy. And if you're not really sick, you don't know you're sick. So he was going around, he didn't know he has a underlying disease because somebody asked a question just now and said a lot of people are not aware of the underlying illnesses. So the fact that you don't know that you're sick, especially for people in Nigeria, doesn't mean you don't have a disease. The fact that you're not laying in bed doesn't mean you don't have diabetes. It doesn't mean you don't have hypertension. So when COVID comes, it blows up whatever you have under that wasn't showing its head before. Am I right, Dr. Lowe?
That's correct. So some of our illness is genetic based. So you can actually figure out if you're at risk for it. So if you have a family history of diabetes, you have a family history of heart disease, or you have a family history of getting strokes, then you may be at risk for it. And if you don't do regular checkups with your doctor, even just what we call a well visit, you won't pick it up. Somebody with high blood pressure, if you don't check your blood pressure, you won't know you have it. If you have in diabetes, it's really a blood test. So to catch it early, you have to check blood sugars. If you don't check it, you won't know you have it. And yes, when you have an illness, it brings it out or it makes it worse.
Okay. Thank you, Dr. Low. I have a question here. Somebody said, after you've had COVID and recovered, can you have sex with your spouse?
Uh, as far as we know, that should not be a problem. If you're recovered and your energy level is good, so there's no restriction to that.
Okay.
Um,
Another question for you, Dr. Low. Can you breastfeed? And I know I called you personally on this 2 weeks ago, but I wanted people to hear it outside, especially in Nigeria. Once you test positive or you have symptoms of COVID, can you breastfeed your newborn baby? And what are the precautions you need to take while you're breastfeeding?
yes, as far as we know at this time, there's no spread of the virus from breast milk to the baby. Given that, but then we know that the virus is predominantly spread through droplets, possibly through some aerosol. So it's really contaminated hands and contaminated skin. That's how you would spread it to the infant. So, or if you start talking or speaking, or even hopefully not coughing or sneezing, that's when you start spreading it to the other individual, right? So probably it's prudent to
Pump.
not have close contact until you have fully recovered from the illness. In most places, that's what we've done for as precaution, so you don't transmit it. You might have seen a slogan I've seen is that uh, avoid men, MEN. So when one is as a precaution, one avoids touching the face, the nose, the eyes, the mouth, so that you don't uh, get sick from it, especially if your hands are contaminated. So the other way to preventing getting an infection is really washing your hands, soap and water for at least 20 seconds, or you can have alcohol gels or what we call the hand sanitizers. So that will prevent you from picking up the virus and transmitting it and getting sick.
Can the breastfeeding mom pump the breast milk as long as she cleans around her breast? Breastfeeding is very big in Nigeria, and
Yes.
that's why I'm asking. Can she
Yes.
pump the breast milk and then feed the baby with the pumped in the bottle breast milk? Somebody else probably doing it for her, but somebody feeding the baby.
Correct. That can be done, of course. You can always store the breast milk. You take proper precautions. Again, hand hygiene, soap and water. Make sure your hands are clean. Maybe it's even better if you can wear a mask before when you prepare all this, so that basically it's a clean process. Yes, you can store the breast milk in clean bowls, and then use that to feed the baby.
Thank you. Damsey, do you have another question now? So you ask some, then I'll continue after.
Okay, so I have, yeah, I do have another question. So I do know somebody who is on the front line, and I'm not sure if we have addressed this in particular, but she's on the front line and she is avoiding any form of sexual intercourse with her partner, but they sleep on the same bed. And I thought to myself, if it's, contracted, if it's a respiratory illness, of what benefit is it to say you're not going to sleep with your partner, like have sex with your partner, but you're still living in the same house with them and you still sleep on the same bed? So I couldn't understand the rationale behind this. Now, this is a Nigerian nurse that I'm speaking about. So what are your thoughts on this again?
I mean, if you already have close contact, I'm not sure why that should be a problem. The main, of course, if you are asymptomatic and if you have virus in your mouth, that's where it actually gets transmitted, right? So I suppose to be reassured, one can either strategy of getting tested just to make sure you don't carry the virus, um, or in even the household, if wants to be careful, I guess you can wear a mask in the household just to prevent any transmission. But and then plus hand washing and social distancing. But if you've made the decision to stay together, and I don't see why that should be a barrier or it should be exempt really from sexual contact.
Okay.
Thank you.
Thank you, Dr. I have a question from an American.
Okay, when you're done.
Yes, he said to the people at home who are anxious to attempt to prevent COVID from infecting their family, apart from the mask and social distancing, are there vitamins that they can take that can, I believe she's trying to say, that can
Okay.
help their immune system?
Yeah,
And then she
medication.
said, can they take aspirin 81 milligram so that they can prevent blood clot? Because blood clot is a typical complications from COVID-19.
Yeah. So, of course, we want to take care of ourselves and stay healthy. If you need to take a multivitamin daily, that's fine. If you're not eating properly, getting adequate sleep, of course, is important. So you need to reach. That's how the body repairs with sleep. So all that is important. There are no specific recommendations on any supplements or anything like that. If you have a deficiency, then you need to correct that. For example, you have vitamin D deficiency, then that needs to be corrected. Um, uh, and I'm sorry, what's the other question
Oh,
again?
let's vitamin C, elderberry, and aspirin to prevent blood clots.
Well, we don't. There's no good data that once you take aspirin, you take aspirin if you need to take it. So patients with known cardiovascular disease, aspirin is helpful in that scenario. Now, preventive aspirin is really controversial, and we do not want to take aspirin as a preventive measure in terms of preventing clots getting COVID-19. What we do in patients who are sick with the COVID-19 infection, we do anticoagulate them when they get to the hospital. Yes, they're at risk for getting blood clots, but that's for treatment in a hospital setting. So it's not recommended to take aspirin if you're healthy and without any illness. If you're thinking of doing this as a preventive measure in coronavirus, no, we don't do that.
Okay,
Okay.
Damson, you can go ahead.
Okay, so another important question that I have, now earlier on, I think about 2 months ago, when,
Mhm.
the bulk of Nigerians really heard about the coronavirus, there was a statement by, I think the President of the United States, um, saying that hydroxychloroquine
Oh,
should be used in treating these patients, and literally every pharmacy in Nigeria ran out of hydroxychloroquine. Literally like, I don't think you would even find it anywhere right now. Like, it is non-existent except maybe in the hospital. So to what extent, okay, by the way, the FDA came out and said they didn't make such a statement, that they were not in agreement with the president. So,
yes.
that kind of threw us, back into, into confusion over here. But nevertheless, people here are still thinking the first thing, once I start feeling symptoms that are similar to coronavirus or malaria, I need to jump on chloroquine. and I need to jump on azithromycin. So everybody literally has these medications in their houses rather, apart from the other ones like vitamin C and all of that. So how important are these medications, hydroxychloroquine and azithromycin, or whatever other antibiotics? Are they really important? Hydroxychloroquine in particular, how important is it with the treatment of in the treatment of coronavirus?
Uh, well, to be direct to the point, we currently are not using the combination of chloroquine or hydroxychloroquine with azithromycin. We're not using that now. In fact, it's dangerous to use them together if you're not in a
Wow.
monitored setting. You can cause
Wow.
arrhythmias. You can actually die from this thing. So there are potentially bad side effects related to this combination. Currently, if one is to use chloroquine or hydroxychloroquine, it has to be in a clinical trial setting.
The hospital.
There are some places that are studying this as an intervention, but overall, we're actually not using it in practice at this time, unless you're part of a clinical trial.
Noted.
Okay,
Noted.
I wanted to point out that Nigerian system is a little bit different from American system. In Nigerian system, you can walk up to a pharmacy and
Mhm.
buy a medicine, and I
Yeah.
believe you know that because you came from Philippines. But when we use hydroxychloroquine in the hospital, I remember at the early stage, it was a trial thing. It wasn't. You have to be in the hospital. That is what Dr. Low is saying for
Mm,
doctor to see whether you need to take hydroxychloroquine or not. Don't go at home. Don't stay in your bedroom, in your living room, and go
mm.
and buy it from the pharmacy next door and take it. So that is what Dr. Lowe is saying. If you are in the hospital and somebody is monitoring you, then if they decide to give you that, then they know the side effect. But don't take it at home, please.
Yeah, let me just emphasize that. Yeah, there are side effects from the hydroxychloroquine chloroquine. You can get hepatitis, that's liver inflammation. Of course, there's what we call heart or cardiac toxicities, arrhythmias. In fact, when we did give the medication, we put you on telemetry,
Let me
that
check.
electrodes on your chest, and we monitor your rhythm and the electrical signal of the heart. So in the event that we call them QT prolongation, it's starting to happen. In fact, if it's a little bit prolonged at the outset, we don't even give the medication. So it has really to be in a, like, pretty much in a cardiac unit to even initiate the medication.
Okay. Okay, thank you, Dr. Lowe. The topic of this program is the lies and the truth of COVID. Before I hand over back to Damsey, I got a text from Nigeria, the WhatsApp text. And it says, when you have COVID, stay in the sun in the morning between 9 and 12 noon.
Okay.
Then it says you can use, in Nigeria, they call it aboniki, but I will explain what it is for you in American terms. Eucalyptus, a very concentrated eucalyptus,
Okay.
extremely concentrated eucalyptus, that you can use that to steam up in a like a humidifier context or a nebulizer context and sniff it so it will kill the virus in your nostrils. That is the second myth. I think let me let you answer those two while I look for the other myths. So do we stay in the sun for 3 hours? Does that help COVID? And do we use eucalyptus to steam up to help COVID?
Yeah, I'm not aware of any good study that says eucalyptus, concentrated eucalyptus, either treats the virus. It may help, I guess, improving nasal congestion. As I might remind you, in Houston, we're in the peak of summer. It's really hot. It's 90 and 100 degrees here, and we have a big outbreak of the virus spreading all over. So it's the peak of summer here, and we have a bad situation.
So
So
I
it's
guess,
really a person-to-person transmission.
okay, I guess what you're saying is staying in the sun, you're just going to get fever. It's not going to really help you to cure COVID.
Right. I mean, stay out in the sun, especially in 100-degree weather. That's not recommended. You can get a heat stroke, actually, or heat exhaustion. So in that scenario, you actually need to get hydrated and stay indoors, not stay outdoors in that high temperature.
Mm.
Okay. One more myth. I promise, Damsey.
Okay.
I got this from a Nigerian text. Um, Coronavirus has a pH of 5 to 5 and 8 to 5. That's a myth. They are encouraging people to drink alkaline water. That alkaline water helps to reduce the pH, thereby coronavirus doesn't survive. Number two, you need to eat a lot of warm and hot food because the burning in your throat helps to kill coronavirus. Please answer that.
Um, well, let's just go back and how the virus is transmitted. So it is from person to person. So you get somebody coughs or sneezes, you catch the droplets, and then ends up in your respiratory tract, and that's how it enters the body, and you get sick from that. Now, whether whatever we take by mouth, whether any kind of liquids, the body will process that and will make that uh, and use it. Temperature, whatever our body temperature is, that's what it is. Usually between individuals between 90, 98, 99 degrees, that's the normal body temperature. All those other interventions mentioned really have not shown to work. There's no scientific evidence to say that those particular interventions uh, work at all.
Okay, Damsey.
Okay, so I'm going to go back to where Mrs. Adeniran was speaking, and she was talking about staying in the sun for 15 minutes. Now, I'm going to rephrase that question because the reason why a lot of people, in Nigeria and maybe all over the world want to stay out in the sun for 15 minutes is because we've been told that vitamin D has a huge role to play with regards to boosting your immunity. And we also know that the best form of vitamin D is vitamin D3, so directly from the sun. So now my question is, how effective is the role of vitamin D3 to be precise, with regards to boosting your immunity and even helping with the virus in general?
The main role of vitamin D is one needs a normal level of vitamin D, so it's 30 or higher in terms of measurements in the blood. So if you have a deficiency, and it is actually a modern man disease, meaning most of us stay indoors, we work in buildings. So at least in the survey in United States, 80 plus percent, 85 percent of the population have some form of vitamin D deficiency. That's because you're staying indoors. So in that scenario, you probably need to take a vitamin D supplement in order to get it back to normal levels. That's all you need. Um, so vitamin D in certain studies show that if you don't have enough vitamin D levels, it does affect white cell dysfunction. Your white cells don't work properly if you don't have proper levels of your vitamin D, or they're not normal. So the idea is to bring it up to normal. So you can take normal. If you have normal levels, you can maintain it with between 400 800 regular units of vitamin D. If there's a concern for deficiency, then you can take actually up to 2,000 units of vitamin D3 a day, and that should be adequate.
Okay.
Dr. Lo, ask a question on that question. I know time is constrained now. Vitamin D3 doesn't really get absorbed on a dark skin that much. At least that is what my PCP told me when she ordered 50,000 units for me. Once you're melanin and you're dark skin, you don't absorb vitamin C from the sun anymore. So I don't think they need to stay in the sun to make sure that they're getting vitamin C. Just to add to that, I have a question here. When a patient tests positive, let's say they are tested before a routine procedure and are found to be positive, are they automatically admitted to the hospital regardless of the symptoms? And do you continue to test until you test negative?
So if one is asymptomatic and you tested positive, you don't necessarily need to be in a hospital setting. So if one is exposed, you test positive. It takes about, it's usually most people, if you become sick, would be between 5 and 7 days. So if you don't get sick, then well and good.
Okay.
Yeah, you don't have to be admitted if you're just testing positive.
Okay. Damsey asked a question earlier and said, can you be reinfected with COVID-19?
Not that we know at this time.
Okay.
So do you build antibodies? Because I tested for antibodies, although I work on the COVID unit, I thought I should be exposed to COVID by now. I mean, maybe asymptomatic of COVID, but I didn't have any antibodies.
Oh, wow. Wow.
Dr. Lowe.
Yeah, well, if somebody's infected with the virus, we do develop antibodies, neutralizing antibodies. It peaks about between 8 and 9 days once you've been exposed. The problem with the current antibody testing, it's not specific for this specific COVID-19 virus.
Okay.
At least in the United States, the antibody test, if you do the coronavirus antibody test, it's positive for any coronavirus. So it could be the common cold that you've been exposed to, and your test is positive. So you don't specifically know which coronavirus.
Okay, I want to answer Amber Nicole's question that do you continue to test until you test negative? I think CDC, Dr. Lowe, correct me, has instructed that if you have coronavirus, like if you test positive, after 14 days, you can go back to work.
Yes.
If you are a nurse,
Mm-hmm.
you have to wear a mask. Is that
Yes,
correct?
that's correct.
Oh, wow.
So what happens after 14 days? Does it mean you are not positive anymore? Or because I've seen people positive for 2 months. So does it mean you are not positive anymore? Or does it mean the virus is not shedding anymore?
No, once if you become ill and you recover, so generally we know you've recovered if, let's say you're sick, you get infected, and then you don't have fever for 48 to 72 hours without any antipyretics, then we count another 7 days from that to make sure you have adequate circulating antibodies in one's body, and that's enough to say that you're not contagious and you have immunity.
Okay. Okay. Thank you. So it's like a total of 14 days. If you can quarantine yourself for like 14 days, then you should, and you don't have fever while you're doing this for over 72 hours, preferably, then you should not be contagious anymore.
Correct. The reason for the 14 days is that in the event you got exposed to the virus, the incubation period is really up to 14 days to get sick.
Oh,
So
yeah.
by the 14th day, it's unlikely, if you don't get sick, it's unlikely that you're going to get clinical infection.
Okay, Damsey, go ahead. I have to release Dr. Lowe. Somebody already came and peeped into your office, like, let's go. So, Ms. Damsey, ask the last question. We might be able
Okay.
to bring him back. Let's hope.
I'll be so excited to bring him back. I don't know when he's gonna have time. I don't know when you have time, but I'll be so excited to bring you back.
We'll
But
pray about it. Start praying on that one.
yeah, let's start fasting and pray. Okay. Dr. Lowe, thank you so much. You've literally answered like a lot of the questions that have been on my mind. Um, and one last thing, actually. one last thing, I promise, out of all the
Mhm.
million questions that I have, one last thing. What is the um I literally haven't heard of like little children. Okay, just one actually. I haven't heard
Oh,
of children under the age of 10 getting infected with the virus and having to be admitted or like exhibiting major symptoms. So again, I'm sorry I have to ask the question about age all over again. How how is it that there's some sort of low risk when it comes to like children under the age of 10 especially? How come they're not being admitted as much as the older people, the adults? And and even if we literally don't have any cases of little kids with the coronavirus in Nigeria. I think I've only heard of about one or two kids in the past 3-4 months. So what do you have to say about that?
yeah, they're less likely to be infected, but there are. It's not that they don't get sick; they do get sick. There've been several reports already of children getting sick. In fact, they have a special manifestation. They get they have an inflammatory response to this virus, and people can get arthritis and skin lesions. That's been reported in the big outbreak in New York City. So there is published literature on this. So the children's hospitals in the area are watching out for this, and we've seen a number of cases. Not as many, thank goodness, but they do get sick too from this illness,
Wow.
from this virus.
Thank
Yeah.
you, Amy.
If
Wow.
I may add before Dr. Lowe, I think I've seen one or two children at a pediatrics emergency that actually came in with diarrhea. They
Yes,
came in
they
with
have.
diarrhea and they are COVID positive.
Yeah, I have
Oh,
to mention actually the at least in the CDC they added new symptomatology for kids, so they can have very mild symptoms, nasal congestion, mild sore throat, and some may have mild diarrhea, and that's it. They're sick from that.
Okay. On behalf
so
of
diarrhea is one of the
yes,
main symptoms of COVID-19. Wow.
It can
Wow.
be
Okay.
in about 20% patients.
okay.
Wow. Okay.
Okay, on behalf of everybody, Dr. Lowe, I mean, you made me feel like a superstar. I feel like a celebrity right now. I don't
You
know.
are a superstar. You are.
I mean,
You are, ma.
to get you out of your schedule to do this, I mean, I really, really appreciate you. Words cannot express my appreciation. Thank you so much for
Thank
loving me
you.
and for loving the community and wanting people to stay safe. And when people stay safe, you have less work. I won't be paging you every third
Yeah.
minute.
All right.
Thank you so
Okay.
much. You have a blessed day. Please
Okay.
Thank
My
you
pleasure.
stay
so much.
on, Jamsey.
Thank
Stay
you.
on.
Stay safe, everybody. Okay.
Thank you, Dr.
Thank you,
Lowe.
Dr. Lowe. Thank you
Take care.
so much.
Bye bye. Okay, now
Woo!
I can.
I'm
Well,
so grateful. Thank you so much, mommy coach, Mrs. Adeniran. Thank you so much. Like he literally just threw the roof off because what a lot of people have said to me, well, it's adults that really need to be scared. Children. Have you noticed that? With children, they don't really get it, and even when they do, they are symptomatic. And then hearing that there's a kids ward, I'm like, okay,
oh yeah,
wow.
children, and we're still live. Children do get it. We had a baby, actually a baby, an infant that came in with diarrhea. And
Wow.
when an infant has diarrhea, the first thing that came to my mind as a pure Nigerian is teething. You know, because when babies bring out teeth, they have diarrhea,
Mhm.
they have
Yeah.
cold. So I
Yeah.
don't know what happened in the course of it. The one of the pediatrics doctor was just like, "Can we just check this baby for COVID?" And everybody was like,
Wow.
and the baby was positive. I think it was like 9 or 10,
Wow.
and the baby was
Wow.
positive. So children can get it. The good thing about children is their symptoms are not as life threatening as adults so far. I think only one baby had died in United States in New York, maybe one or two babies. I'm not
Wow.
sure. Don't quote me on that, but I think one or
Wow.
two babies have died from it. Babies don't
Wow.
get as sick as adults. But guess
Mm.
what? There is a
What?
study on CDC that is investigating permanent lung damage from COVID.
Wow.
They're
Oh
still
Lord.
studying it. It is not approved yet. It is not valid yet. But they're
Mm.
studying it to see if after you get COVID, your lungs can remain damaged forever. This is what I want to say. If you have symptoms, especially in Nigeria, we play with fire too much. We like a
Yeah,
fire brigade approach.
yeah,
If
yeah.
somebody is dying, we don't run for care.
Mm,
Please, at least if you know you are having symptoms, do something. Ask
mm,
questions. You can look for Ask Damsey online and post a question to
mm,
her. You
mm,
can look for I am Bumi Adeniro on Facebook, on YouTube, on Instagram, as well as
mm,
Ask Damsey. Post a question. I will take
mm,
it upon myself to send it to this doctor. This is what this doctor does. He's a COVID doctor. That's what I call him.
yeah,
That's what he
yeah.
does for a living. So ask question. Don't stay home until you die and cause your family
Mm,
pain.
yeah.
Please. And don't think every disease is malaria. Because I had a friend's husband that died and they were treating malaria, but then a day
Wow.
before he died, they realized it was COVID.
Oh,
And by the time they realized it was COVID, it has already entered the lungs. Once
wow.
it enters your lung, then sa- surviving is very difficult. You can have COVID
Mm,
and survive and go home in 2 days. But if you allow it to enter your lungs, then there is really, really not, not nothing the hospital can do. So please ask
wow.
question.
Yeah. Ask questions. Yeah, that's
Okay,
another thing.
I have a question here. COVID is not as lethal as what we have been informed before. True or
Hmm.
lie? Okay,
Okay.
what I have seen right now, and I'm not an infectious disease doctor, but I work on a COVID floor as a nurse. What I've seen right now is that, and I haven't been to work in a while too, so is that people don't die as fast as they did at the early stage. And I've asked Dr. Lowe that personally before. When COVID just started, a lot of people were dying. We were not getting handle of it. But I think
Yeah.
by the help of God, the infectious disease and FDA and even the
Mm,
president, as bad as you may think,
mm,
they are
yeah.
working together now to get a
Yeah.
handle on how to treat it.
Yeah.
So people are dying less. The cases are going high, but the mortality rate is going
Mm,
low. So, which
okay.
is a good thing because in my personal opinion, not doctor, not FDA, it is a virus. And almost
Mm.
everybody will get it, whether we want it or not.
Oh,
Almost
wow.
is like flu.
Wow. Yeah. Yeah.
It's like in America, we get flu every year. So maybe until the vaccine come out or something like that, almost everybody will get it. But
Wow.
but we're not
Reality.
gonna get it now, I hope, because the hospital is jam packed. You
Mm.
don't want to get it now because you won't have a
Mm.
bed. They won't be able
Wow.
to treat you. So
Lord
don't
God.
expose yourself to it now. Maybe 2 years time, when there are vaccines, there are medicines. If you get it, it's easier to cure. So that is why
Mm.
we are reducing the number of people that are getting it right now. Social
Mm.
distancing, face mask, hand washing, eating very well, sleeping very well. You just added that to it. Sleeping very well helps to
Mm.
replenish your cells. So that is just my little contribution to it.
Wow. Thank you
Don't
so
stay
much.
in the sun. Don't be eating hot food.
Don't use aboniki balm, dear Nigerians. Don't go and buy hydroxychloroquine randomly and start treating yourself with that because the side effects will not be funny. A lot of people are actually allergic to chloroquine. A lot of people, even before this whole pandemic, is that's one medication that I know that a lot of people cannot tolerate. That's from having malaria in general. So it's not something that you should use unsupervised, just like Dr. Lowe said. So if you're a Nigerian and you're just tuning in, I know that a lot of us have hydroxychloroquine in our house, as well as a host of other different medications that we have Googled or have heard from different places. In fact, this Aboniki balm one, when I heard it, I was just like, wow. It's like from one myth to another to another myth is like, when is this going to end? And it's mentally exhausting. I really can't wait for this pandemic period to end. I don't know about you. I don't know how you're keeping up in this season, Mab. Being on the front line. If I had to physically see, I'm very emotional, so I literally cry for anything and everything. When I'm very happy, I cry. When I'm sad, I cry. If somebody does something really good for me, and I just want to jump for joy, as opposed to jumping for joy, the first thing I do is I cry. So I probably will be one of those nurses in the ward that maybe somebody comes in and they can't breathe properly, and instead of doing the oxygen mask and whatever it is, I'll probably be like, oh, what's going on here? So I don't know. Like, it's well done with what you're doing. It's not
Well,
easy. And thank you so much for your labor of love, because it is a labor of love. I don't know how you do it. I don't know how the people on the front line are doing it, because if we over here are seriously afraid of this virus, then all I just wake up every morning, I'm just like, blood of Jesus. That's literally because I'm like, God, I literally don't know what else. There's so much. Do you use neem leaves today? Oh, vitamin D tomorrow, vitamin C, elderberry, azithromycin, everything. I'm just like, God, it's too much going on. So I'm just gonna stay at home, wear my face mask, and keep pleading the blood of Jesus also, because I literally don't know what to do with this issue. But thank you for giving us insight about this. Thank you so much
thank you so much.
for
And I
your
want to
time.
say anybody can be a nurse if you are called to be a nurse.
Mm.
Because I don't think
Bold.
I can do what you do. No, I can't do
Yeah.
what you do. I'm not as disciplined enough to eat the way you program food and all of that. I don't think I can do it, but I can
You
really.
can.
Yes, I will. I will. Let's leave that. I will. But I can see dead people and don't worry about it.
No way. Oh my gosh.
Yeah,
Wow.
not that I don't feel bad,
Yes, I know. I
but
know. I
I'm
know.
not gonna
I
cry
know.
if
Yeah.
somebody's dying. I can feel hurt. Well, my
Uh-huh.
colleague is gonna say that's a lie because I still cried a couple of weeks ago for a particular
Oh.
patient. But we're
Oh.
all wired differently, and that's what's good
Yeah.
about life. Whether black,
Yeah.
white, green, or yellow,
Yeah.
we are wired
Yeah.
to do something, and let's
Mm.
just do what we are wired to do.
Yeah.
And that would
Yeah.
help us have a better world, have a better life,
Yeah.
your
A
own wealth.
purpose-driven life. Yeah.
Yes. Yes.
Mm.
So thank you so much. I hope I can squeeze Dr. Lowe again. I don't
Yes. I need the both of you. I need him. I need you. We need
but
to, just.
Dr. Lowe has a partner. If you go on his website,
Uh-huh.
www.westhoustonid.com, there's a partner of Dr. Lowe that I may be able to steal. She's a female. I
Yay.
may be able to put a female touch to it as well.
Um,
So I'm gonna try to steal her. I don't know when, but let me
Please.
keep my fingers crossed. Well, viewers, I am Bumi Adeniro. Thank you so much. And this is my sister.
Yes, thank you so much for watching. My name is Adedamola Ladijabi, and I'm the founder of Ask Dams and also Ask Dams Wellness Institute. Now, my should I say my followership is heavier on Instagram than on YouTube or Facebook. But thank you, Dr. Adenira, for bringing me on here. There's a lot of work that we need to do together, that's for sure. And thank you so much for answering a lot of the questions that I had on my mind. Yeah, so signing out officially, I think. Thank you for watching, everyone.
Um, I do Instagram. I do have more followers on Instagram, but the
Uh-huh.
problem, yeah, but the problem with Instagram is you cannot feed. It's difficult to feed you, me, and somebody else on
Yeah, multiple
Instagram.
people.
Yeah,
Yeah,
but
you can only do two.
yes. So we will post this on Instagram, IGTV. We will,
Awesome.
yeah, we will upload this part, and I will
Mm.
tell our internet crew to post it on IGTV. We will post it on I am Bumi Adeniro, and we will post it on Ask Damsey as well. Whatever you
Yay, thank you. Ask Dams, yes, and Ask Dams Wellness Institute.
yes.
Ask
So we try
Dams.
to post it by the end of the day, hopefully.
Awesome.
But
Yes, thank you.
pending that, go on Facebook and Bumi Adeniro, go on YouTube and Bumi Adeniro. You can watch it, and then when we post it on Instagram, it will be there for everybody on both handles to watch. Thank you so much. You have a blessed day. Ciao.
Thank you so much. Bye.
Bye bye.